this question was a little bit tricky, but I tried to find kind of a comparison to a more well-known type of, is basically a way to provide a synthesis of the literature or of the evidence. And my understanding is that often a scoping review is conducted when there might be a knowledge gap that needs to be identified, or to perform a generalized scope of the field, or to clarify any ideas or concepts within a field. And scoping reviews differ from systematic reviews because systematic reviews often use strict and systematic methods to evaluate international evidence, and they use this review in order to make a conclusion that will likely change practice in the form of a guideline, for example. So a scoping review methodology was selected for this paper and for the study because we wanted to generally scope the literature in the field of AAA screening in older adult men in order to point out any knowledge gaps and to try to inform primary care practice going forward. I think this paper emphasizes the importance of screening for AAA by highlighting the mortality benefits and the cost effectiveness of screening. But I also think we were able to highlight other aspects of screening that might be overlooked, such as the negative impact it might have on the quality of life in older adult men. In our discussion, we talked about openly discussing AAA screening with each individual patient and transparently addressing what it might mean for them if they were found to have a AAA, or alternatively, what might happen to them if they have a AAA and we don't screen for it or try to detect it. So I think one of the biggest takeaways that come from our discussion in the paper is the importance of shared decision-making with patients. So, regardless of what the evidence tells us or how important we might think it is, it's important to have that open discussion with your patients to see what it is that they want, inform them of the benefits and the potential harms as outlined in our paper, and come to a mutual decision together about what is best for that individual patient. If anything, I hope our paper creates an opportunity for primary care providers to review the guidelines around AAA screening so that they can themselves look into the evidence further and decide whether the screening is right for their patients or not, because it's important to be well versed in the evidence and in the guidelines so that you can have that informed discussion with your patients.